Since arriving in Belize several weeks ago, the men and women of the United States Southern Command have been busy undertaking various humanitarian projects across the country. As part of the annual initiative known as Beyond the Horizon, a team of doctors and engineers and other specialty officers have built classrooms and medical centers, among other vital infrastructure, in a number of rural communities. This morning, they gathered for the inauguration of the Ladyville Health Clinic.
It's building our capacity to increase access and coverage for the population. As you know, we are faced with a challenge in terms of our facilities are still built to cater to a very small population, and over the years it has grown. And we need to increase the capacity to be able to cater to the needs of the population. And the area of Ladyville and Lords Bank in particular has grown significantly since we had since we built the initial health center. So that's going to help us in being able to provide better service for a larger population.
Those services will be carried out chiefly from this location, a 1,560 square foot building that was built by a U.S. Army task force.
3 projects of opportunities. One of them was to paint the 2-story building that is next to the one that we built. Also, we identified the need of having a handicap ramp in this building, and that was not part of the scope. So we did the design, and also then we bought the materials and built it. And with the ramp, we also built the railing for it. We had a welder from our home unit for Buchanan, Puerto Rico. That's where my home unit is. And he's a welder as a civilian, so he did the welding of the handrails.
The overall scope of work, according to Adrian Galanek, Chargé d'Affaires at the United States Embassy, also includes the provision of medical and dental services. Not all of those works, however, were outlined in the initial list of assignments.
Some of those projects, those additional projects that occurred, like the painting of the existing clinic structure, those are all projects that the teams identify themselves, and then they work with their colleagues, and they just do it. And many of those extra projects are out of the troops' own resources and their own time. So it's really hasn't made much additions to the budget because they've assumed those resources themselves. But the overall cost of the project is approximately $11.5 million. But as I just said earlier, really the real way to measure the project is it's priceless, just in terms of the relationships that have been built, the contributions from the different members of the community, from local governments, from the private sector, from our service members, from the BDF, Ministry of Health, the Ministry of Education. You just can't measure that in dollars and cents.
The benefits of the recent works, says Ministry of Health CEO Dr. Ramon Figueroa, go beyond just the physical buildings.
Not only are we improving our infrastructure, but we, as you well know, we have clinics that are being held at the community level. And so that's an expansion of services, and with it comes medication and equipment as well. So that's for a benefit in terms of the overall service being provided to the population.
Reporting for News 5, I am Isani Cayetano.